Welcome to our core presentation today. I would like to call forward, please, Troop 228, our local Boy Scouts troop, to present the flag.
On behalf of the Organ Donor Corps, we are presenting this flag to Meadville Medical Center.
Thank you. Thank you very much, Boy Scout Troop 228. As you may know, my name is Ann White. I am the Vice President of Rehabilitation and Outpatient Services at Meadville Medical Center. Mary Ann Houston, who is our Chief Nursing Executive, was disappointed she was unable to attend today. First of all, though, I would like to thank all of you for being present at this ceremony. Your attendance shows your commitment not only to organ donation, tissue and cornea donation, but to your professions. You are true advocates for health, well-being, and ultimately life. We know that making organ, tissue, and cornea donation requires you to go above and beyond at each of your jobs every day. It requires sharp response time, quick thinking, and extraordinary precision, very much like the gentleman showed with the folding of the flag. But also it includes unending compassion, understanding, and empathy. Many of you have offered patients and their families a shoulder to cry on. It's not a job that you get to leave when you clock out. And for that, we hope you know just how appreciated you are and how much your job matters. National Donate Life Month marks the perfect time to reflect on the difference that you make. Nationally, there are more than 118,000 people waiting for an organ transplant. Every 10 minutes, that number increases as someone new is added to the National Transplant Waiting List. Just consider that number for a moment. But just one person can have an incredible effect. One individual has the potential to save 8 lives through organ donation and as many as 75 lives through tissue donation. Those numbers, coupled with the stories you will hear about today about those affected by donation, could and should stand as an inspiration for what can be made possible through donation. At Meadville Medical Center, we are here to support you and provide you with the resources that you need to continue to make life possible. And now I would like to introduce Dr. Katie Warren, our neurologist, for her words. Thank you.
Hello, everyone. Thank you again for coming today and having me. As she said, I'm Katie Warren. I'm one of the neurologists here at Meadville Medical Center. I started here about a year and a half ago, so I've only recently become involved in our program here through CORE and helping patients and families that are going through this situation. I'm often involved mostly in the ICU when there's a patient that hasn't had an unfortunate circumstance and may be a candidate for donation. So I'm involved in examining that patient and speaking with their family to let them know what the next steps might be. In the time that I've been here, there's been 2 or 3 cases that we have found that might be patients that might be able to provide this life-changing donation. And one case did ultimately result in that, and we were able to affect multiple people that were waiting on the transplant list to help them. And that was about 6 months ago or so. So that was a wonderful outcome to what, of course, is an unfortunate circumstance for someone else. So it is always a difficult situation. And we, of course, want to keep in mind and reflect on those families that have lost a loved one, but also remember how much benefit they can provide to someone else. And we have been able to do that successfully here in Meadville. The volume of the patients that we treat for that here is on the lower side. We're a smaller community hospital, but I think it's a really great thing that we can do here despite our size, and we certainly need to thank the people that are involved in those patients' care to allow that to happen. So I just want to extend my thanks to those people that have been helpful in those situations. And again, those that go above and beyond their clinical, typical clinical involvement and providing empathy to those families that are going through these difficult times. So thank you again for everyone coming to support our mission today, and I will pass it on to the next person. Thank you.
Thank you, Dr. Warren, for your words of wisdom. I would now like to introduce Susan Stewart, who is an important member of the CORE team, the CEO. Welcome.
Thank you so much. Thank you, everyone, for taking time out of your schedule to be here today as we celebrate National Donate Life Month. As was said, I'm Susan Stewart, and I do have the privilege and the honor to serve as the CEO for the Center for Organ Recovery and Education. Our central purpose at CORE is very simple. It is to deliver the gift of life through organ, tissue, and cornea donation. But we can't do this alone. It requires all of you to help us carry out that mission. We only have 120 some employees, but yet we serve over 5 million individuals. So you can see it takes an entire community to make the process work. The gift of life is only possible because of the selfless choice made by an individual who made that pledge for life by saying yes to donation, or because the family who at one of the worst times of their lives made the choice to say yes to donation. While the choice to save someone's life might seem easy for some of us, it's not so easy for some families who have never discussed organ donation. And so they're trying at a very difficult time to decide what their loved one would want in the event of their death. So with this in mind, we dedicate ourselves to promoting organ donation awareness all year long. But in particular, in April, we do this during National Donate Life Month at such events as these. National Donate Life Month is also a time for us to pay honor and tribute to the true heroes of the transplant process, and that is the donors, and to the donor families. It's also a time to celebrate the recipients who have received these wonderful gifts. And we have some recipients that are with us today that you will hear from. This April, we hope to inspire each and every one of you to make donation your cause. We hope that you will spread the word about donation because we can make a difference and we need to make a difference. There are 8,000 Pennsylvanians that are waiting for that call that an organ has become available for them, and many, many more waiting for the call for tissue and for the gift of sight through cornea donation. The work that you do in this great institution is nothing short of heroic. It is your commitment and your dedication that makes donation possible. It's the physician who has to talk to the family about that difficult prognosis and help the family understand brain death. And we are so grateful for you for doing that. It's the nurse who gives that gentle touch or the kind words that bring solace to the family. It's the social worker who spends a little extra time with that family in need. It's the innovative spirit of members of the Meadville Donor Advisory Group led by Tony Pierce. Tony, you are a great friend. You have been an amazing friend to CORE, and we thank you for everything that you have done to help build the culture of donation at this great institution. You are also the proud recipient of the Thomas Pelusiani Scholarship, which will be used to create a memorial plaque at some location to be determined, hopefully today. So next year, when you all come back, you're going to see a memorial plaque to honor and pay tribute to the donors of this community. In 2016, you each made this world a better place. Your passion provided the gift of sight to over 16 cornea recipients. Your passion gave a second chance to 4 transplant recipients who received a life-saving organ. And you enhanced the lives of over 675 tissue recipients. Please give yourself a round of applause for that great work. And you may be a small community hospital, but you are doing great things for patients. Your support serves as a guide to CORE in our efforts to promote our mission to save more lives every year. You've shown an unwavering commitment to our cause. So on behalf of the recipients, donor families, and CORE, I'd like to offer our sincere gratitude for your advocacy, your compassion, and your commitment to our life-saving cause. I thank you for this opportunity to be here, and I thank you for your continued support regarding organ donation. So thank you. And now it is my honor, as we have been discussing how important organ donation is throughout National Donate Life Month, we're going to show you firsthand how critical it is. And it's just such an honor to have a wonderful recipient with us today to emphasize the power of donation and transplantation. As a mother and a daughter, they share a very, very special connection. And to share this remarkable story with us, I would like to introduce Aaron and Abby.
Hi, I'm Erin. This is my daughter, Abby. Abby needed a transplant about 2012. And there was really no other option. Abigail was not able to be on dialysis because of some complications with some other surgeries that she's had. So this was kind of our only hope, was a transplant. So I was the first one that got tested immediately, and we were a perfect match. And we had our surgery about 8 months ago, and thanks. We're doing great. No? You good? Okay, I guess she doesn't want to say anything. Abby had one kidney removed because of reflux about 2011, and right after that there was some complications from that surgery that caused her other kidney to have quite a bit of damage. So we went into the hospital and she had to get a urostomy that kind of took a lot of pressure off the kidney to help it out, give it a break, and we were able to extend the need for a transplant for about 5 years. Yes. So, yeah.
So, for those of you who don't know me, I'm Alyssa McQuillan with CORE, the Center for Organ Recovery and Education, and I am the liaison here at Meadville. I work closely with Tony Pierce, who is awesome, so we appreciate everything Tony does. But also we appreciate everything that every person does here in the hospital and within the community. We don't just provide education at Meadville Medical Center, but we extend into the community to mind-body wellness, Active Aging. Some of our lovely individuals from Active Aging joined us today. So I just really want to thank the community as a whole. We're now partnering with Crawford County Hospice, so we're very excited to continue to grow in our program, and we just want to thank all of you for taking time to be here today. This is really important, and thank you to Abby and Aaron for sharing your story. It's very incredible that Abby is sitting up here 8 months after transplant. I had a little chance to talk to them, and it's just an incredible story to go through the testing for living donation. They were a perfect match, and that's a very special bond that they have, so we appreciate them being here today. And to the Boy Scouts as well. It takes all of us to come together to celebrate Donate Life Month, so we appreciate all of you. So I just want to offer you, if you're all willing to walk up the hill, we're going to raise the flag outside of the emergency department. So we can use the elevators and go to 1 if you want to do that, or you can just walk up the hill. So thank you, and please feel forward to come forward and take pictures. We would like that. So thank you guys, and I hope you have a wonderful day and celebrate throughout the rest of the month. Thank you. All right.
Joining us now, Dr. Katie Warren. Important topic today, the core.
Absolutely.
Let me ask you about. Okay, so maybe it's 30 years ago, but forever ago, I heard a complaint one time. Well, if I'm a potential organ donor, is a doctor going to really try and save me if I get in an accident or if I'm sick? I haven't heard that since then, but I heard it once. So what would your answer be?
Yeah, that's an excellent question. I think that as a hospital, as a physician, our number one goal is always to care for the patient that's in need at the time. So we will, of course, do everything in our power to help save someone that we can. But there, of course, unfortunately, are times when someone is not able to be saved or may not have the functional recovery that someone may interpret as good quality of life. And that is, of course, a patient decision, a family decision, sometimes a religious or cultural decision. So we never bring up organ donation or even get core involved in a patient's care until the patient is actually already determined to have brain death. And so we always focus our care 100% on the patient in front of us at the time. Now, if someone then is determined to be brain dead, which is a very specific neurologic exam that I do, and is repeated multiple times to make sure that we're not missing something, then we start thinking down that path. So we don't even contact core or discuss this option with patients' families until the time is right.
So let me ask you the technical side of that. How do you decide if it's time?
Yes. So the exam, I don't know how much anatomy I should get into there, but there is a very vital structure of the brain called the brain stem, and it connects the brain to the spinal cord. And that brain stem provides most of our kind of vital functions, so breathing, heart rate, and what are called brainstem reflexes. So the ability for your pupils to get smaller when you go into bright light, or your ability to gag on something if you choke. So the way that we test someone for brain death is we're actually checking those functions of the brain stem. And so someone isn't clearly able to participate in that exam. We can't ask them to close their eyes or ask them to lift up their arms like we would do in, say, a stroke patient, for example. But in this case, we have certain maneuvers that we do to the patient so that we can identify if their brain is still functioning. And if their brain stem reflexes are not intact, then that tells us that there's no messages getting between the brain to the rest of the body, and therefore they would be determined to be brain dead. And patients that are candidates for donation typically are, unfortunately, younger patients that have had some sort of traumatic event, unfortunately, drug overdoses, things like that. So they often have healthy bodies otherwise. Typically someone who's older or has had many infections or has had cancer may not be a good organ donor. So we consider that as well. But the exam itself is kind of the first step to starting to have this kind of conversation.
Question about your other work. A lot has changed in recent years about stroke care here at Meadville Medical Center. Can you talk about that for a second?
Absolutely, yeah. So the biggest change that we've had in Meadville Medical Center since I started here is we have a program through the Cleveland Clinic called Telestroke. And Telestroke is where they actually bring kind of a robot with an iPad and have a video conference with a stroke-trained neurologist out of Cleveland Clinic, so obviously a world-renowned facility, to evaluate a patient within minutes of them arriving to the emergency department. Now, myself and my partner were always on call for neurology, but I don't live in the hospital, so I'm not able to examine them on the spot. So this allows their exam to happen almost instantaneously and make what can be life-changing decisions on the spot, primarily regarding what we call a clot buster medicine called TPA. TPA has to be given within 3 hours of the onset of stroke symptoms. So having that decision made, the sooner the better, is better for the patient. So that's the biggest change that's been there since I've been here, and we've had, since that program has started, we've had increased numbers of stroke patients treated with TPA with better outcomes. So that's been great.
So we've all seen the signs up with face drooping and difficulty speaking and all that kind of stuff. If that's going on, I think I'm going to lay down for a while, see if this passes. Not the right thing.
Not the right thing at all, no. There are, of course, times and places where you don't want to rush to the ER for everything, so I know people have that thought. But when there are symptoms that are what we feel are clearly stroke symptoms, so drooping of one side of the face, not able to hold both arms up symmetrically, not able to move both legs symmetrically, and another one is actually numbness on one side of the body, which isn't something that you would see on an exam, but you have to feel that yourself. Or having difficulty talking, and usually that is either slurred speech or choosing the wrong words to say. Those are pretty common stroke symptoms, so if that happens, the sooner you get to the hospital, the better, because the sooner we treat you, the better your outcome can be. So those are definitely times to get here and see our telestroke provider through Cleveland Clinic or myself.
So be aware of those kind of things, yes. and we don't want you to be a customer for CORE way too soon, right? We want that to be at the right time.
Right, exactly.
Well, Dr. Warren, thank you very much.
Yes, thank you for having me.
Joining us now, Alyssa McQuillan. Am I saying your name right?
Yes.
Well, welcome back to Meadville Medical Center. You helped us with our community conversation, but now's a big event here. Talk about the event today.
Yeah, so today we are celebrating National Donate Life Month. It's a nationally recognized date that we celebrate with our hospital partners once a year, and that's to really recognize all of those who have given the ultimate gift of life, who have received a life-saving organ transplant, or who are currently waiting. So today, CORE and Meadville Medical Center joined forces to just celebrate and recognize all of those individuals who make a pledge for life.
Let me ask you, with my biased hat on, how are we doing here at Meadville Medical Center?
Meadville Medical Center is doing an excellent job. The community and hospital are very supportive of donation. In 2016, the hospital was able to save the lives of 4 individuals through organ donation, which is incredible. So 4 individuals that were on the waiting list for they could have been on the list for a very long time, did receive that call that they were going to receive the gift of life because of the work done here at the hospital.
It's one thing to hear statistics and to see so many thousands of people are waiting and so on. To actually see a survivor and the donor together here today, it was really moving.
Yes.
Let me ask you about that. This isn't the only place that thing comes along, but all those thousands of people we're talking about, those are real people.
Yes.
So what do we do? I know when I sign up for my driver's license and get it renewed, I just check the box. Mm-hmm. Is anything more to it than that?
So there's multiple ways that you can register to be an organ donor. At the DMV, they always ask you the question, would you like to designate yourself on your license, yes or no? But oftentimes at the DMV, the conversation really ends there. So if you're in a hurry, you might just run away and not think much of that decision. But it's very important, and it's important to know what it means when you check donor on your license, because we will do everything in our power to fulfill your wish. So it's equivalent to an advance directive. So you can, of course, designate yourself at the DMV. You can go online at any time and update your license. You don't have to wait for your license to expire. And you can also go on core.org, learn more about what it means to be a designated donor, and make that decision on our website.
You headed me off on my last question. And where do I go to learn more? So go to core.org, mm-hmm. Is that right?
Yes. Core.org, you can learn a ton about donation and what we do. Our service area, we cover 155 hospitals, but there's 58 organ procurement organizations nationwide.
Well, Alyssa, thank you for being with us.
Yes, thank you for everything.